Welcome everyone. So today let's learn about antenatal assessment of fetal well-being. Okay, so let's quickly dive in. Let's not waste our time. Okay, so before we start, let's see some critical statistics of fetal death. Okay, so 80% of death occurs during antepartum. Okay, and the majority of fetal death occurs before labor begins, which means before the baby is born. So 20% are unexpected, such as stillbirths with no obvious identifiable cause. Okay, 30% are asphyxia related and which are like death due to IUGR or post-dated complications. Okay, and also remember important causes includes chronic fetal hypoxia, maternal complications like diabetes and hypertension. So that is why during ANC visit every woman are screened for diabetes and hypertension. Okay, fetal congenital malformation and unexplained factors. Okay, so that is why understanding these statistics helps us prioritize monitoring effort. Okay, so what is the primary objective of antenatal monitoring? So the first one is prevent fetal death. So how we do this? We should detect, and there should be an early detection and intervention to avoid preventable loss. Number two, it is to ensure growth. How we do that? Throughout the pregnancy, there has to be a satisfactory monitoring of the fetal development. Okay, and number three is to screen the high risk factor, and here how we do that, we should rule out or identify high risk condition which can affect the fetal growth. Now let's see the different parameters to assess the fetal well-being. So the first is one has to measure the mother's weight. So throughout a pregnancy, a woman should at least put on around 9 to 12 kg of weight. So the first trimester, which means the first 3 months, she has to put at least 1 kg. And but after that, from the second trimester, she has to put at least 1 or 2 kg per month of weight. Okay, but during the third trimester, if her weight and if there is an excessive increase in the weight, then it is a manifestation of preeclampsia. Okay, that we need to look for. The other two, and the other thing is there, if there is an insufficient gain of weight, then it suggests that it can be IUGR. Okay, the second one is very important, which is blood pressure monitoring. So the initial recording before 12 weeks of gestation, it differentiates between chronic hypertension or from pregnancy induced hypertension. Okay, after that there is a need of fundal height assessment. So after 24 weeks, that is 6 months, the distance in centimeter should correspond to gestational week. That means 1 centimeter corresponds to 1 week. Okay, so if there is a variation of 1 to 2 centimeter, that is acceptable. So plus minus 1 or 2, it is acceptable. Okay, so now let's learn about the fetal movement monitoring method. This is one of the most important method to assess the fetal well-being. The first one is the Cardiff count 10 formula, where the mother is asked to count the movement of the fetus from 9 a.m. to 9 p.m. There has to be the movement has to be more than 10, and if it is less than 10, she is again asked to check for the movement the other day, the next day. Okay, number two is the fetal movement count, where the mother is asked to count the baby's movement for 1 hour each in the morning, noon, and in the evening. Okay, and after that she has to add them up and multiply by 4 to estimate the movement in 12 hours. Okay, if the total movement is less than 10, then it means that the baby is not doing well, um, or the baby needs an immediate intervention. Okay, number three is what is the clinical significance of checking the fetal movement. Remember, the mother can perceive or can feel the baby movement 88% of the time, which is almost like 90% of the time. Okay, which is same as detected by the Doppler. Maybe the Doppler can pick almost all the movement, which can be like the smile or facial expression or even the small hand gesture or movement that the Doppler can pick. But majority the baby movement also the mother can also perceive or mother can feel the movement. Okay, so the other thing is loss of movement often is followed by fetal heart rate disappearance within 24 hours. Hence it is very important to for the mother to check for a fetal movement. Okay, so now let's learn about the stress test. Okay, it is a non-invasive test done during pregnancy, and usually it is done after 28 weeks of gestation. And why do we do this? It to check if the baby's heart rate increases when the baby moves. Okay, number two is this also tells us whether the baby is getting enough oxygen and nutrients from the placenta. So as a nurse, what do we need to look for? First is the baseline FHR. Okay, the normal is 110 by 160. Okay, so the variability, so now we need to check for the variability. So variability is the normal wiggling in the heart rate. Okay, and the normal is 6 to 25 beats per minute. Okay, the variability. And number three, what we need to see, the acceleration. Acceleration is the increase in the fetal heart rate when the baby moves. Okay, and if the baby is more than 32 weeks, and the fetal heart rate should rise more than or equal to 15 beats per minute, and it should last for 15 seconds. Okay, but if the baby is less than 32 weeks, then the fetal heart rate should increase by more than or equal to 10 beats per minute, and it should last for 10 seconds. Okay, or more than 10 seconds. So do not get confused between the variability and acceleration. Variability is the continuous background. Here, there is nothing to do with the baby's movement. Okay, it keeps it is a continuous activity, whereas in acceleration is measured when the baby moves. Okay. Number four, also to check for the deceleration also. That is a drop in fetal heart rate. It is abnormal and it should be reported. Number five, contraction. Okay, note if present and how fetal heart when during contraction, how fetal heart rate responds. You need to check for that as well. Okay, so now let's learn about the different methods to assess the fetal lung maturity. Remember one thing, lungs is the last organ to mature in fetus. Okay, so the first gold standard test that can be done is the LS ratio, which is lecithin and sphingomyelin ratio, where the ratio has to be more than 2. If it is more than 2, that indicates the pulmonary maturity. Okay, number 2 is the shake test, where the amniotic fluid is mixed with the ethanol, and if the bubble is formed, then that means the surfactant is present, which means the lungs is matured. Okay, we also have a laminar body count, where the count has to be more than 30,000 per microliter. If it is there, that means it indicates lungs maturity. Okay, and number 4 is the phosphatidyl glycerol, where if it is present, that means it indicates that the lung is matured. Okay, thank you so much everyone. If you liked it, please do share with your friends, and do not forget to like, share and subscribe.